a Parkinson's drug that can blur your patient's vision permanently. The FDA has issued a new warning about Amantadine on July 2025. In this video, I'll break down what this FDA safety alert means, and what key monitoring steps every healthcare professional should know while prescribing Amantadine. Amantadine is approved for treatment of Parkinson's disease, and it is used off-label for a variety of conditions, including multiple sclerosis-related fatigue and disorders of consciousness. As of July 2025, a warning about corneal edema has been added to the United States prescribing information of all Amantadine products. Corneal edema is a rare complication. Incidence rate is between 0.1 to 1%. This adverse reaction has been reported beginning few weeks to several years after initiation of Amantadine. Symptoms of this adverse reaction include sudden onset of blurry vision and/or progressive vision loss, with or without eye pain. Corneal involvement is usually bilateral. The mechanism of Amantadine-related corneal edema is unclear, but may represent an idiosyncratic reaction and/or dose-dependent endothelial cell toxicity. There are several risk factors for Amantadine-induced corneal edema. Number 1. The corneal endothelial cell toxicity is dose-dependent. Therefore, high cumulative dose, greater than 100 mg per day, especially greater than or equal to 200 mg per day, may have a higher risk of toxicity. Number 2 risk factor is being older adults. Age-related decline in endothelial cell density makes cornea less able to compensate for cell loss induced by Amantadine. 3. Pre-existing corneal endothelial disease such as previous corneal surgery, for example cataract extraction, keratoplasty, or history of ocular trauma is another risk factor that predispose individual to Amantadine-induced corneal edema. 4. Concomitant use of cornea endothelial toxic drugs, for example amiodarone and hydroxychloroquine. Other risk factors include renal impairment, which can increase plasma concentration of Amantadine and enhance toxicity risk of this medication. Individual susceptibility, such as possible genetic or immune-mediated predisposition. Some patients develop edema within days to weeks, suggesting idiosyncratic sensitivity. With these risk factors identified, here is what healthcare professionals should do next. 1. Baseline corneal evaluation is recommended before initiating Amantadine in high-risk patients. 2. Monitor patients for new changes in vision, including blurred vision with or without eye pain or vision loss during Amantadine therapy. 3. Counsel ophthalmologists to rule out corneal edema if vision changes occur after initiation of therapy with Amantadine. 4. Taper and discontinue if corneal edema develops. 5. Avoid rechallenge, as recurrence is common. 6. Advise patients to inform their healthcare providers if they develop any visual symptoms. Prognosis of Amantadine-induced corneal edema. This adverse reaction is reversible. Resolution of symptoms typically begins within weeks of Amantadine cessation. However, corneal grafts have been required in some patients when the condition is not recognized. Permanent damage can occur if Amantadine is continued. Corneal edema from Amantadine is rare but serious. As healthcare professionals, let's stay alert, educate our patients, and prevent vision loss. Thank you for watching. If you found this useful, consider subscribing to my channel for more clinical updates and practical tips.